to Sustainable Health Empowerment Health Education Series. My name is Moza Hamoud, and I am a fourth-year medical student at St. George's University. Today's telecast is the fourth and final in our series on breast cancer, which is the most common cancer in women in the United States and globally, aside from skin cancers. Today, we will focus on staging and treatment options. So let's jump right into it. Our objectives for this episode are to identify types of breast cancer, identify stages of breast cancer and what they mean, define metastatic cancer, understand symptoms and ethnic risk factors for inflammatory breast cancer, to distinguish treatment options, to recognize psychological issues related to mastectomy, and last but not least, to identify resources for support during a cancer diagnosis and treatment. In order to decide on the most effective treatment, the types of breast cancer and the stage of that cancer are important. Let's see what that means. Blood tests may be done to determine what kind of cancer is present, and they may take time to come back. The following are the types of breast cancer. You can have an HR positive breast cancer, which is the hormone receptive one. Some tumors need hormones to grow, and hormone targeted therapy can block their growth. HER2 negative or positive. HER2 positive breast cancer is a breast cancer that tests positive for a protein that promotes the growth of cancer cells. HER stands for Human Epidermal Growth Factor Receptor 2. HER2 positive breast cancers tend to be very aggressive, but treatments that specifically target HER2 are very effective. Triple negative. Some breast cancers, between 10 and 20%, are known as triple negative because they do not have estrogen or progesterone receptors and are not HER2 positive. Many breast cancers associated with the breast cancer gene BRCA1 are triple negative. They are often aggressive and are treated with surgery, chemotherapy, and radiation. As we learned in an earlier episode, staging is based on the size of the cancer and whether and where it has spread. In order to determine staging, other tests may be performed. Bone scans and CT scans may be ordered to see whether the cancer has spread. A biopsy of the lymph nodes is often performed to see if the cancer has spread. In what is known as the sentinel lymph node, studies may help the surgeon to determine if lymph nodes are to be removed. These tests can show whether the cancer has spread, and if so, where. Breast cancer can spread to almost any part of the body. It is important to understand that when the breast cancer spreads to other tissues, such as the bones, it is breast cancer cells that are found there. This is what is called metastatic cancer. Stage 0, also known as ductal carcinoma in situ. Stage 0 is when there are abnormal cells only in the breast duct that have not moved to other parts of the breast. Stage 1 is when cancer cells have invaded parts of the breast but have not gone anywhere else, and the tumor is no more than 2 centimeters or 3/4 inches. Stage 2. The tumor is small but has spread to the lymph nodes under the arm, or it's between 2 and 5 centimeters and may or may not have spread to the lymph nodes under the arm, or it's greater than 5 centimeters but it has not spread outside the breast. Moving on to stage 3. Stage 3 means that the person has locally advanced cancer. The tumor has advanced to the lymph nodes under the arm, or the nodes have attached to one another or to other structures, or the cancer has spread to nodes behind the breastbone. Stage 4 is a distant metastatic cancer. This means the cancer has spread to other parts of the body, such as the liver or bones. A rare type of breast cancer, which is more common in the Black community, is inflammatory breast cancer. This, unfortunately, is a very aggressive cancer, and a lump or tumor is not always detected. Because cancer cells block the lymph vessels, the breast looks red and inflamed. Other symptoms are pitted appearance, itchiness, and or tenderness. Women of African American heritage should begin breast self-exams in their 20s and have to go for regular screenings. Paget disease approximately accounts for 1% of all breast cancers. Cancer starts in the breast ducts, then spreads to the skin of the nipple and the areola. Paget disease is usually associated with ductal carcinoma in situ or invasive ductal carcinoma. Symptoms may consist of the nipple and areola being crusted, scaly, red, bleeding, oozing, burning, or even itching. So, let us review what we have learned so far. Here's the first question. Please keep in mind that multiple answer choices may be correct. What does the breast look like in a person with inflammatory breast cancer? Does it look puckered? Does it look red? Does it look swollen? Or does it look shrunken? If you selected it looks red or it looks swollen, you will be correct. Moving on to the next question. Stage 4 is what type of cancer? Is it the distant metastatic cancer? Is it lymphoid cancer? Is it the localized advanced cancer? Or is it the inflammatory cancer? If you selected distant metastatic cancer, you will be correct. Is it true or false? Inflammatory breast cancer is a common type of breast cancer. If you selected false, you will be correct. Treatment options vary depending on the type of cancer and the stage. They include surgery, radiation, hormone therapy, targeted therapy, and chemotherapy. The healthcare team will decide on the best option depending on all the factors we have discussed, as well as the person's overall health. Surgery and radiation are local therapies because they are performed at the site of the cancer. Hormone therapy and chemotherapy, on the other hand, are considered systemic because they work throughout the entire body. Ask your healthcare provider about possible side effects of any of the therapies. Surgery is the most common treatment, either complete breast removal, called a mastectomy, or partial removal, commonly called a lumpectomy, may be combined with radiation, hormone therapy, or even chemotherapy. Be sure to ask your doctor all about the treatment recommended, including their adverse effects. When you're being treated for cancer, you have an entire team on your side: oncologists, surgeons, maybe a reconstructive surgeon, nurses, and nutritionists. Ask for help when you need it. Being proactive and trying to stay positive will help you throughout the process of treatment. Remember, too, that other women are an important source of help and support, especially those who have had cancer. For many women, the thought of losing all or parts of your breast is frightening and damaging to their body image. And yet, in many cases, a mastectomy can save your life. Who could be better to help you through this than another woman who has gone through the same thing? Ask your oncologist, local library, or community center for help in finding breast cancer support groups. This week, we have explored staging of breast cancer and treatment options. The key thing you should remember is that annual exams are critical to detecting breast cancer early so it can be successfully treated. We'll see you again next week. Here's to good health and good habits. Thank you for tuning in, and be sure to check out our next episode and all the episodes in this health series on our YouTube channel at Sustainable Health Empowerment.